Hello, good day to you. It's Talkin really, and today's story is in the London Economic. The story is about the last 10 years and basically how many people have passed on, which they reckon is 250,000 people in 10 years as a result of austerity and, of course, now the COVID crisis. So the London Economic headline, Tory policies have killed 250,000 people in the last decade. Austerity deaths and COVID policies have sent tens of thousands of people to an early grave. A decade of Tory austerity coupled with the most recent COVID mismanagement has killed over 250,000. An exclusive TLE investigation has revealed more than 100,000 people have died following social security cuts, whilst around 120,000 perished due to reductions in health and social spending. And experts have predicted that the COVID-related death toll will be over 60,000 and is double the number it needed to be, coupled with tens of thousands of lives cut short by a failure by successive governments to impose tougher legislation to tackle air pollution. And you have a pretty grim picture. So the headline is quite serious, and it's a study that's been done. As part of a Tory-Liberal coalition and later Tory government reforms, unprecedented numbers of social security claims were denied or terminated. Between March 2014 and February 2017, 119,590 deaths were recorded by the DWP. The deceased had recently been flowed off, whatever that means, I don't know, but they're off incapacity benefits, severe disablement allowance and or ESA. Obviously, many died as a direct result of that. Stress triggered fatal heart attacks, strokes, seizures. Significant numbers with depression killed themselves. Anxieties shortened the lives of terminally ill people, and some starved to death. In the same period, life expectancy declined as well. There's quite a number of examples, and then in addition to the previous mentioned cuts, we have cutbacks on health and social care. A few years ago, the BMJ published a study suggesting that 120,000 people in England alone had died and would die between 2010 and 2020 as a result of health and social care cuts. DWP cuts killed people of all ages. Health and social spending reductions mainly ending the lives of the over 60s. And this report minces no words with how it speaks. According to the study, between 2001 and 2010, under Labour MPs Tony Blair and Gordon Brown, average per capita health spending increased by 3.8% a year. Deaths decreased by 0.77%. Between 2010 and 15, under the Tory-Liberal coalition, annual spending increased by just 0.4%, and excess annual mortality increased by 0.87%. The majority of the estimated 45,000 excess deaths between 2010 and 14 occurred in care homes. Since 2010, the Tories have cut local social care budgets by 9% per person. Age UK found that by 2019, 1.3 million pensioners, including those who could afford to pay, were waiting for care home vacancies. Between June 2017 and December 2019, 74,000 elderly people in England alone died without receiving the social care that they needed. Care providers typically said that applicants either do not meet eligibility requirements or the applicants are passed to other service providers. And obviously, considering the effects of cuts to the healthcare system, over 5,000 people died between 2016 and 2019 on hospital trolleys after waiting between 6 and 11 hours for treatment. And there's quite a number of examples. Of course, we then have to talk about the decade of Tory Liberal cuts brought much of the UK to the brink of collapse. And then, of course, we had the COVID-19 crisis, which the Tory cult of ultra-neoliberalism first reaction was to save profits by carrying on as normal. Boris Johnson told Business in February, humanity needs some government somewhere that is willing at least to make the case powerfully for freedom over exchange. Johnson said that the UK, meaning the poor and vulnerable, would be that country ready to take off its Clark Kent spectacles and leap into the phone booth and emerge with its cloak flowing. Obviously, he turned out to be a super spreader, boasting on the Freedom March that I was at a hospital where there was a few virus patients and I shook hands with everybody. By June, the National Statistics Office had reported 63,000 excess deaths. Ergo, the Johnson administration is responsible for at least 30,000 COVID-related fatalities. The Tory machine's lies worked for the 2019 general election, but the public is now fooled less and less, although there are still quite a few people who believe the rhetoric. At the time of writing this article, Johnson's approval rating is lower than the opposition leader, but he has absolutely zero chance of getting in. I think that he would be just as bad. So there could be a chance of a Labour government, but I very much doubt it. And there we go. So the facts are there. For anybody that doesn't believe it, open up your eyes and you'll see that it's true. Right, that's me done. Have a good day and bye for now.